Richard Brandt. Hello, class. My name is Richard Brandt, and this is Group 1. We are presenting an interview with Dr. Cheryl Cox. We are excited to be here, and we are looking forward to speaking with Dr. Cox today. We are unfortunately missing one of our group members, Donna. She wrote our narrative for us, and unfortunately she was called away on family business, so she won't be able to be with us. But she did participate, and she is with us in spirit. We would like to introduce ourselves. We have Allie, Roxanne, and Stephanie.
Hi, I'm Allie Bombalier, and today I will be Cheryl Cox.
Hi, my name is Stephanie, and I'll be interviewing Cheryl.
Hi, I'm Roxanne Bernard, and I'll be interviewing Cheryl as well.
All right, great. Stephanie, would you like to start off our interview panel for us today?
Yes. Okay, Cheryl, this is my first question. What do you feel the most widely used nursing theory developed by you, and can you tell us about it?
All right, well, the interaction model of client behavior, health behavior, was my first model I developed. This model addresses individual behavior through the uniqueness of the client and the influence of the healthcare provider through the client-provider component. This model offers support for determining the optimal ways for a nurse to connect with their patients to reach positive health outcomes. This model can be applied to any healthcare atmosphere. It can benefit nurse practitioners as it is broad enough to encompass the scope of advanced practice, but specific enough to provide role clarity and a basis upon which to guide client assessment, diagnosis, interventions, and health outcomes. I hope this model will help and assist you in your career now as a nurse practitioner.
Thank you. What drew you to develop the interaction model of client health behavior?
Well, there have been many critics of nursing theory who have scrutinized major theorists because their framework do not depict ways to think about patients in nursing, since they did not provide conceptual models to develop hypotheses or tools that can be empirically tested. So I created this model to describe the multiple factors of health protective and risk-taking behavior based on the physio, psycho, socio, environmental dynamics, and to identify specific provider interactions that affect health outcomes. Basically, the uniqueness of each patient was used to explain differences in health outcomes.
Perfect. And my last question will be, what areas of research are you most interested in, and what drew you to these specialties?
The type of research that spikes my interest is health and risk behaviors in chronic illnesses, as well as what motivates the health behaviors in individuals.
Okay, hi, Ms. Cox. How are you?
Good. How are you?
Good, thank you. Ms. Cox, I would like to ask you a couple of questions.
Sure.
Do you think your theory addresses the idea that healthcare providers can influence the client's behavior?
Well, I conceptualized my theory when I encountered other theorists that dealt with health behaviors from a sociological approach, influences from family or support systems and other surrounding variables. The middle range theory is defined as coherent articulation of a set of concepts that describe and explain relationships that are related to a particular phenomenon. I, however, recognize that there is a deficit to current theory. Although they use various factors that affect patient behavior, it did not do so by looking at patient as an individual. When a provider builds the relationship and formulates a plan that is catered to the needs of the patient as an individual, this in turn affects patient motivation and participation, thus ultimately changing patient behavior and improving health care outcomes.
Do you think that using a holistic approach to delivery of care directly is related to this change in behavior?
So although a holistic approach to care is ideal, it falls short if the approach is not catered to each patient as an individual. There is, however, a process for change in order for behavior to occur. That is treating the patient as an individual, developing the patient-provider relationship, and implementing nursing interventions that are client-focused, altogether facilitating the behavior change.
Finally, do you believe that the interaction model of client health behavior is a successful model? And if you do, why?
I may be a little biased, but yes, I do believe it is a successful model. This model has been used as a basis for a large number and a variety of health behavior studies. It has been used for studies on adults, from prenatal diagnostic testing to health promotion behavior in military personnel to smoking cessation. It has also been used for pediatric and adolescent behaviors studies, such as contraceptive use among adolescents and children's health promotion behaviors. These are just a few examples. With its magnitude of the use of the variety of studies, yes, I do believe it has been successful.
Thank you, Ms. Cox.
Thank you.
Thank you, Dr. Cox. I have a couple questions for you.
All right.
First of all, what research are you currently working on, and how does it relate to your theory, your IHMB theory?
I'm currently working on 3 main research projects. The first is symptom cluster subgroups in adult survivors of childhood cancers. The second is a web-based screening and intervention for high-risk drinking and eating behaviors. And the third is a motivational interviewing study of physical activity behavior changes in arthritis. These all tie into motivating good health behaviors, which are in line with my theories.
Great. And my final question is, what settings do you find your theory is most applicable? And what changes in the clinical area can we as nurses make to practice your theory?
I find my interaction model of client health behavior is applicable in every clinical setting. The clinical nurse can get to know their patients personally, so they know their health habits at home, and then encourage patients to continue to make good health choices and educate them about areas that they can improve on and change.
Great. Well, we thank you so much for joining us, Dr. Cox. And
Thank you for having me.
we appreciate you answering our questions. Thank you so much.
Thank you.
Thank you, Dr. Cox.